The use of telehealth services and virtual nurses increased dramatically during the COVID pandemic in response to a need for infection control, increased patient load, and increased interest in virtual services from the public. According to Hardy, by 2020, as much as 75% of people surveyed preferred to use telehealth with their PCP. During the rapid rise in the use of telehealth, some changes may have occurred more rapidly than was prudent. Telehealth may have changed the face of public health and private care faster than safety protocols could be developed. The need for reduced contract and increased access prompted a trade-off. Telehealth offered better access to care during a time when office staff was reduced and the need for assessment and examination was enhanced, but it shifted focus to more self-reporting, meaning more subjective information. Hardy writes about several advantages to telehealth, as evidenced by research. Ease of use and lower costs improve patient experience and improve access to care, making telehealth an important tool for solving disparities. The availability of an asynchronous format where providers and patients can communicate freely via email or chat makes telehealth a convenient option for care delivery. And the result has been better outcomes, improved communication between parties. But there are some downfalls to electronic formats. Barriers to access are different from those found in office visits, but still real. Scheduling across time zones, lack of internet access, and issues with quality of connection can create new blind spots for delivery. Virtual nurses, like telehealth doctors, are remotely located and tasked heavily with observation of patients. Virtual nurses can be found in different settings, but one important application of this technology is direct patient observation in a hospital unit. According to Muir et al., these remote nurses can be relied on to improve surveillance of patients during times of very high census. They can be valuable in the ICU environment when tasked with medication titration and protocol initiation. In their survey of nurses who had worked with virtual nurses, Savitz et al. Found that nursing staff appreciate and rely on improved monitoring when virtual nurses are utilized. As with telehealth, the use of technology with certain populations creates a barrier to care. Muir et al. Points out that older, sicker patients on medical surgical units struggle with communication and technology barriers when in-person care is not available. Savitz et al. Found additional problems with the implementation of virtual nurses. They found that the usefulness of the technology was limited by the virtual nurse's access to the EHR, and that effort could be wasted due to task duplication. Concerns also arise when considering staffing, with a need to determine whether a virtual nurse improves nurse-to-patient ratio, or it only seems to by the numbers. While telehealth and virtual nursing offer clear advantages, barriers still exist, and they are not appropriate for every situation. Just as you wouldn't use a virtual stroke assessment to diagnose a heart attack, these technologies do not improve outcomes unless they are used appropriately. Most concerning, if patients who lack virtual access begin to lose in-person care as services shift online, we may reduce the benefit through poor implementation, and more research is also needed on the impact of reduced personal interaction in care. Overall, these technologies represent developing fields that require thoughtful regulation, research, and planning to maximize their benefits.